My name is Dr. Erin Mayfield, and I am board certified in lifestyle medicine and obstetrics and gynecology. I've been working with patients for over 40 years. I am delighted to share my experience using a teaching kitchen to help people learn how to use food as medicine. As physicians, we know that there are many barriers to behavior change, and behavior change is especially difficult for people addressing daily food choices. There are so many factors that contribute to a person's choices, the most obvious being the taste of the food. However, there are also subconscious issues that contribute, such as family and cultural traditions, social influences, food addiction, and the marketing influences from the food industry. Adding to the complexity of the problem are individual issues like work schedules, raising children, access to cooking appliances, budget, cooking skills, and even navigating the grocery store. All of these factors can create a barrier to fostering the curiosity and courage needed for people to experiment with new food choices. For me, the most efficient tool to affect behavior change around food choices is teaching culinary medicine in a teaching kitchen. In my class, you will receive evidence-based tools along with the format that I've developed to empower and excite participants to leave with new hope to improve their health using food as medicine. So please join me. Thank you.